Each year, over 500,000 Americans undergo rotator cuff surgery in search of relief. However, with high post-operative failure rates impacting 1 in 5 patients due to issues like poor healing, extended recovery periods, or re-tearing, the need for improved outcomes is more urgent than ever. So today, we're looking at bioinductive implants, an exciting innovation in rotator cuff repair. But first, let's meet Denise.
I have been flying for 37 years. We are required to push and pull carts that can weigh about 300 pounds. The job that I do, closing overhead bins, carrying heavy metal trays, over all the years, it just was wear and tear. I couldn't lift my arm over my shoulder. It was just sharp pains. It really affected me because I like being busy. I have a big family. I have a great group of friends that we all like to get together. We rollerblade, we do planks, we do all kinds of athletic things, and it takes a toll on your body when you can't do certain things, especially with having grandchildren and wanting to pick them up and roll around and enjoy life. Just pick up and go. You realize, ouch, I can't do certain things. In 2020, I decided to take 8 months off to see if I could rest it, hoping ice and more exercise would assist the healing process, but nothing would happen. So I decided to speak to Dr. Simovic. So we had an interview. The shoulder had some calcification and a partial tear, and he recommended that we'll do a little bit of therapy, but it got to a point that I just couldn't use my arm. I couldn't raise my arm. It was just too painful. So Dr. Simovic said it would be best if we move forward. So we moved forward with the decision to have surgery.
Joining me now is Dr. Ryan Simovic, a board-certified orthopedic surgeon and sports medicine expert. He also specializes in complex shoulder conditions. Welcome, doctor.
Thank you.
So let's start, doctor, with just what are the most common causes of rotator cuff conditions?
So the most common cause of rotator cuff tends to be degenerative changes in the rotator cuff. It's one of these things that's age-related changes of the tendon. The tendon gets weaker as time goes on, but there's also traumatic tears of the rotator cuff. For example, from a fall or from skiing, things like that nature. There are 4 rotator cuff tendons in the shoulder. Each one of them has a different function. Some are to elevate the arm, others are to rotate the arm and give strength, but they provide a stability to the shoulder so that the arm has meaningful motion. And when things go wrong with the rotator cuff, generally it results in pain, limited range of motion, diminished function. A lot of patients will be affected in terms of how they play sports. Some will have difficulty at work. Others just have a difficulty with what we call activities of daily living, or ADLs. And so the common pathway is pain. And a lot of these patients will have a fair bit of pain during the day, but especially at night. And so when the rotator cuff tears happen, patients tend to have a lot of debilitation.
Can it heal on its own?
So that's the problem with rotator cuff tears. They just don't heal on their own. So I always like to tell patients partial thickness tears, which would be tears that are through part of the tendon but not fully through the tendon, will tend to eventually turn into higher grade partial tears, and partial tears eventually progress to full thickness tears, and full thickness tears then get bigger as time goes on. Unfortunately, the body is not able to heal it on its own. Some patients can improve without surgery, but the tendon actually never heals by itself.
What do people normally do when they get one? Like they'll put a heating pad, they'll put ice, ibuprofen, right?
Yeah, so I think generally that's the case, which is a lot of patients initially will think that some rest will help, void motion will help, they'll do ice, they'll do Advil. I think those things can be helpful sometimes at getting rid of some of the symptoms, but unfortunately it's one of those things that the tendon does not heal. So those things are not going to fix the problem.
So what are some types of rotator cuff repairs?
So the typical treatment for rotator cuff tears is usually repairing the tendon, and the way we historically do that is through use of what we call suture anchors and sutures, where we go in arthroscopically and we put these anchors that look like drywall screws into the bone that have sutures like thread that comes out, and as we tie the thread, it ties the tendon back down to the bone, and that's usually how we treat most rotator cuff tears. Some tears respond to conservative treatment, which you kind of alluded to, which would be anti-inflammatories and therapy, but from a structural standpoint, fixing them usually means suture and suture anchors.
And is that why post-operative failure rates are so high?
That's part of it, because the biology of tendon repair is just so poor. The common theme with them is that it's a very avascular area. There's not a lot of blood flow to that area. There's very few places in the body where there's such little blood flow, but the fact that there's so little blood flow there makes it that even if you were to reattach the tendon, there's a chance that it's not going to heal.
So there's more to be done. There's something else that we can look forward to?
Well, there is. I think that's the most exciting part, is that a lot of our techniques have changed over time. The way we repair tendons, the way we treat partial thickness tears, that's changed. And our implants are better than ever. We're able to more securely fix a tendon, but the rates of failure are still pretty high. And so the fortunate thing is there's been a lot of advances now in the biology of tendon healing, and particularly utilizing bioinductive implants. And so there's one bioinductive implant called REGENETEN, which I've used now for over a decade. And that's really been a significant change beyond anything else in trying to improve the biologic healing of these rotator cuff tears.
And we're going to talk about that. I'm going to take a quick break, but I want to hear about that. So when we come back, more on this. We'll be right back. Welcome back, everyone. We are here with Dr. Simovic, who is talking about an enhanced healing solution for after rotator cuff surgery. All right, doctor, so we talked briefly before the break about an innovation. Tell me more.
So the REGENETEN bioinductive implant, it's type 1 collagen, which is what tendons are made out of, and it's a size of a postage stamp. And during this procedure, we lay it over the top of the tendon, and then we use a secure fixation device that's able to fix it to the tendon and the bone without having to use sutures. Once it's fixed over the tendon, that's essentially the procedure. And this implant is then going to resorb after 6 months, and in the process of resorbing, it's going to increase the thickness of the tendon. So I definitely use it for all types of rotator cuff tears. We can use it for partial thickness tears, we can use it for full thickness rotator cuff tears, and partial thickness rotator cuff tears. The nice thing is we don't have to use suture anchors and sutures to repair the rotator cuff. We simply place this bioinductive implant over the top, and once the REGENETEN's over that, it exerts its biologic effect. Again, over 6 months, it's increasing the tendon thickness. When we do it for full thickness rotator cuff tears, we then fix rotator cuff tears with suture anchors and sutures, but in order to aid the biologic healing, we then put the REGENETEN bioinductive implant over the top of the rotator cuff once fixed.
It sounds like this could be truly an effective solution for so many.
It is. It's very applicable to most rotator cuff tears and really can help patients tremendously.
Did you recommend this for Denise?
I did.
How did she do?
She did great. So she had a partial thickness rotator cuff tear, had some calcification, or what we call calcific tendonitis. Normally, that's a relatively difficult recovery, especially if you put suture anchors and sutures in. For her, we didn't have to. We simply removed the calcific deposit. We cleaned up the rotator cuff tendon. We put the bioinductive implant over the top, and she did great.
Let's see how she's doing. Let's check in with her.
Sounds good.
Let's do it.
When it came time for surgery, Dr. Simovic really took the time to explain what he was going to do. He was going to go in and apply the collagen implant to speed up the recovery. And after 3 weeks, I believe I was out of my sling and able to use my body, and it gave me the ability to really do everything that I love, especially be with my family and the kids and just love on them and be able to pick them up and swim with them and get back to work. And I'm so fortunate and so grateful that I am able to have mobility that I want without pain. I would highly encourage anyone that is in such pain with their shoulder to go with the collagen implant. It has really helped me. I really enjoyed being back, fully recovered and ready to move forward.
Wow, Denise is doing really good. Any final thoughts, doctor?
She really is. You know, so for 2 decades, I've been a shoulder surgeon. For the last decade, I've been using the REGENETEN bioinductive implant. Just like Denise, it's helped a lot of patients. Whereas we've been flirting with really high failure rates over the course of the last 2 decades, we're now starting to see this transcended. We're starting to see patients succeed where they weren't before. And it's really been an exciting technology advance.
Love it. Thank you so much for the information.
Thank you.
Thank you, doctor. And if you want more information on this subject that we discussed today, visit regeneten.com. You can always check out our website, accesshealth.tv.